Good day, my dear postgraduate students. Welcome to the classes on recent advances. Which of these is greater, the small ring summer or the heat generated by the forthcoming exam? You people shall tell me, at least in due course. The article for the day is Pathology in the Undergraduate Curriculum by Paolo Domizio of R.A.T.S and the Royal College of Medicine, London, from recent advance 22. Such topics will be seemingly simple, but then there is an imperceptible blend between medical education, the changes in the medical education, and the mode of teaching pathology. What is exactly expected of a student of pathology is too much to answer. Nevertheless, I have done my best to present you with this topic. The author has dealt with this particular topic of undergraduate teaching in pathology under the following headings. Each one of this is a heading, and we people should realize that each one can sometimes be a volume by itself. For example, the foundation course, autopsy teaching. What is the modernization of teaching? Computer assisted learning. Such things are all in evolution. And even the renowned teachers are finding it difficult to cope up with these changes. Hence, I would advise you not to be worried too much, but listen to exactly what I'm going to talk for over the next 20 minutes or so. In the introduction, the author says, he gives a background picture of a pathologist sitting with a tray of about 20 to 40 slides for reporting. At the same time, he gets a call regarding the problem-based learning and the students awaiting it. Also, immediately, he is called to give his expert guidance on a patient presenting with acute orange, for which a guided FNAC is being done. What is he or I trying to say? The pathologist is a multifaceted person, not a simple scientific teacher as the basic sciences. So you have got a facet of a teacher, a facet of a reporter, then a diagnostic personnel, and finally the patient is also depending on you. This is some of the remarks on teaching, something that I have read several years back. After several years of medical graduation, I feel that 50% of what I have learned is wrong. Unfortunately, I do not know which half. So there is a blend of sarcasm and truth in it. Because the teaching and the learning are both difficult and conceptual. Unless we have the maturity of mind to appreciate the concept of it, it will be difficult. Then there have been those yesteryears of conventional teaching, teacher-centered teaching, and there are some bodies such as the Medical Council of India or the National Medical Commission, which have brought about several changes. They are trying to change it into a student-centered mode of teaching. So far, so good. But then the topic is, what is going to be the impact of pathology on the undergraduate teaching or the undergraduate teaching on pathology? Why teach pathology? This is one of the subheadings. Obviously, you people know that it is a Pandora's box. It bridges the gap between the basic sciences, which means anatomy, physiology, and biochemistry, and clinical medicine, any of the clinical subjects that you people can name, except probably psychiatry. There is a language and a framework of disease that should be needed and learned by the student. There are voluble or voluminous arguments for and against the changes. The author says pathology is more than a simple science. It is humanistic, as we are seeing in this picture. The patient is on the operating table and a frozen section is being cut. There will have to be communications with the colleagues, and that communication also should be knowledge based. In this background, where do the students stand? Some of these cartoons I had picked up from the cartoon stock, which I would very much appreciate if your institute recommends or purchases. Look at this one. There is a discussion between a senior and a junior person. Obviously, one is a pathologist. And he has narrowed down the diagnosis to 16 possibilities. There lies pathology. Now, is pathology teaching extinct or becoming extinct? We know that there is a shift from the didactic lectures. Didactic means a teacher walks in, there are hundreds or more of students, and then he addresses them with a topic. It moves towards integrated, and they are systems based. Systems mean it is not computer system, cardiovascular system, respiratory system, etc. More emphasis is being laid on self-directed learning. And also we note that the teaching time has been cut. The medical curriculum itself is being reduced from 5 to 4.5 to 4 years now. And the number of teaching hours for pathology has come down to 80 hours. And we do not know whether it will disappear from the curricula itself. So this is the scenario. So he says, is pathology teaching extinct? Sadly or surprisingly, this is the debate that is going on in India right now. What is a modern curriculum? What is need? What is next? What should we people read? Is it going to be towards a lecture, or is it going to be objective type of questions? So on and so forth. But then, this particular article, I feel, is more than 5 years old in the UK, wherein identical problems have been analyzed, studied, and put forward. It is sad that the pioneers in our country are yet to realize the pitfalls in their work. So it is fact-based, not just a science, and it can be centered on problem-based learning. These are certain additional things. Obviously, there is a lot of confusion that is there, and this is one. Confusion is a word we have invented for an order which is not yet understood. I think this will exactly fit in for the MCA or the National Medical Commission. What are your comments on it? It is not uncommon. For example, if there is going to be a very learned person in a particular discipline at the Tata Memorial or the Ramchandra Hospital or any other place which you might recollect, there will be hundreds of students, thousands of students rather, thronging, either online or offline. And you find that the hall itself is full, and such is a lecture. All years, you can appreciate the concentration that the students are having. Still, it has got its own weightage. It all depends on who stands and what they deliver. It is not that anybody can become a lecturer. But then we all talk about different methods, which I will be analyzing for a different reason. Small group teaching, etc. What are your comments on this? Is it required or should it be done away with? Now, what are the major causes for the change in the curriculum? This has been going on for nearly 30 to 35 years. And fundamentally, we have seen that the responsibilities have shifted from individual doctors to multidisciplinary teams. This is a wonderful word because nowadays, if somebody falls sick, we all discuss to which hospital the patient should be taken. It is not to which doctor the patient should be taken. So it has become a multidisciplinary teamwork. And such a change is being reflected in the curriculum. These bodies have tried to bring in and educate the undergraduate student in the curriculum changes. Why? Because the expectations of the doctors have increased from the patients. Whether it is becoming student centered or not, it is definitely becoming patient centered. And there is a change in the doctor patient relationship. Doctors have got more ethical and moral issues to confront. And there are no instructions as to how to manage the problems. Effective communication will be needed. In this background, if you can think of a very successful person, you find that he is a good doctor, no doubt, but then he has got a personality and a mode of communication. What is the effect of pathology on tomorrow's doctors or tomorrow's doctors on pathology teaching? So you find that there have been major changes in the medical curriculum, of which pathology is still a component. The content and the teaching methods are being changed. They say that common diseases will have to be addressed rather than rare diseases. Whereas when it comes to a competitive exam, we find that rare diseases rule the roost. There have been surveys on the future of pathology way back in 2001, and now it is 2023. And most of the schools have reduced the time allotted for pathology. I find that there has been an axe falling on the histology and general pathology as well. That is what has been recommended. Whether these are required or not is a totally different story. But then if you try to remove too much of a foundation, the building has got no meaning. There is also a reduction in the pathology teaching time. And the suffering, it varied from school to school. Systemic pathology, on the contrary, fared much better, and teaching of the morphological changes have been neglected in favor of epidemiology. This again, today when a question is being given, the students are able to write the incidence, what is the genetic change, what is the molecular mechanism behind, rather than the morphological change or the histological variance. And pathology is being integrated throughout the course with other subjects. So much so, people start feeling that it is not required as an independent subject. It all depends. It all depends on the person who is behind it. And a lot of these have been brought in. So please do understand that there are lots of changes that are being brought in, and whether pathology will be able to succeed as a standalone subject, future will tell us. What will be the effect of tomorrow's doctors on pathology teaching? The same thing continues. I find that there has to be a knowledge along with the context that is important. The mechanisms and the presentation will be equivalent to the knowledge. So today you find that there is a problem-based learning, self-directed learning, web-based tutorials, and where is the dedicated pathology course in any of the colleges? Has it got a space and a say? We do not know. This again is one of my favorite Grant Medical College. Of course, the picture is taken from the alumni, where I had learnt my autopsy thanks to Professor Vagoliker and Dr. Lanjev. Now, what is the demise of autopsy teaching? You find that there is a difficulty in retaining the organs. There is a closure of museums. MCI says it can be reduced, it can be shared. So much of space and specimens are no longer required. Funding is difficult. And to my knowledge, even the autopsy specimens are difficult to get. No longer can we get an entire specimen of a lobar pneumonia or a bronchopneumonia, for that matter, even a myocardial heart, infarcted heart. Autopsy demonstrations are being rare. That is why only such institutes are able to stand the test of time. The opportunities for the students have also become decreased. This I have discussed in my various classes on autopsy. You can go back to them. And only selected modules are available. So, is the need and the necessity for autopsy teaching decreasing? So, this cartoon stock, I would very much advise you people to go through and recommend. I am not sure what is wrong with you. We will wait for the results to come back from the autopsy. Then definitely we will be knowing the final diagnosis. It's a wonderful one. Now, what are the advantages of an autopsy itself? It is continuing. Look at this. You can see the curiosity, and obviously these things will be registered in the eyes behind the brain behind the eyes that are seeing it. So something is being done, demonstrated. Nicholas, an anatomy lesson. So the autopsy becomes well documented. It is an educational tool. You get a complete specimen. The spread and the impact of the disease in autopsy, in pathology, is definitely useful. And by experience, it has got positive and valuable results. It cannot be replaced by virtual studies or virtual autopsy. But the problem is even the coroner's autopsies are nowadays being restricted. Even in Bombay, I heard that the number of autopsies per day have come down. What is the impact of the changing curriculum on pathology recruitment? Look at this one. It might be difficult, but only thing I could see is it is a cyclical change that is going on continuously. So there is a continuous improvement. Analysis, plan, act, and observation. Then there is an improvement. Again, there is an analysis, plan, act, and observation, through which there is a consolidation. You can call it by different names, continued medical education, so on and so forth. But then it is continued. But in the UG curriculum, we see that it has changed from the teacher to the student center. The disciplines are becoming integrated. Preserved specimens are being replaced by images, museums by websites, and pathologists from direct contact to irregular computerized interaction. So much so, maybe at an interview, we'll have to answer something or face something like this. You are the right man for some other job. A polite way of showing the door. So I wish we buy these for our institutes. This is by Thomas Huxley. The burden we place in the medical student is far too heavy. A system of medical education that is actually calculated to obstruct the acquisition of knowledge and to heavily favor the crammer and the grinder is a disgrace. Thomas Huxley, he was a biologist, and he has had a lot of this Darwinian thoughts. See the tension and the stress on the student. So this is Huxley. Modernization of pathology teaching. There have been huge advances in pedagogy over the past 2 to 3 decades. Two areas, knowledge and the context or applications, are being concentrated upon. More emphasis have been given for the usage of laboratories. Mechanisms of disease, general pathology is taking a backseat when compared to systemic pathology. So, which is the best way to teach pathology? We shall be seeing. Whether it is understanding or a factual knowledge or both. What is this dedicated pathology course and integrated teaching? Dedicated pathology was what we had seen until now or in the near past. You find that there is a specimen that is being described, it is being mounted, kept for the examination, questions asked, we analyze and we learn. But later, it has been replaced by this so-called integrated teaching. And this is another person, Harden. He has got a lot of modes of study, and one of his thoughts was integrated teaching. So this is the entire medical curriculum and the mode of teaching. It starts as a spiral. So in the first year, few topics are interconnected. For example, it can be the thyroid function test, and the pathology and anatomy of thyroid. In the second and the third years, you find that more and more subjects are being brought into it or topics brought into it. Finally, you find that nearly 80% of the portions are being integrated. So this is a beautiful helix that have been brought by Arden. He is a pioneer in medical education. So much will be enough for the time being. And this again are the different methods of teaching and learning. Initially, it is isolation. You take the femoral triangle, you learn it. Then you are aware of certain things, the respiratory functions. Harmonization, maybe between the various subjects. Nesting is any common topic. Like this, it goes on. Finally, it becomes multidisciplinary and even interdisciplinary. Nowadays, it is not restricted to medical subjects alone. You find that engineering has got, biomedical engineering has come in. And finally, that can be a transdisciplinary approach. So this kind of a concept is difficult to comprehend right now. But if people have an idea about it, which is better now, a dedicated teaching or an integrated teaching. So these are the advantages given. I would like you people to kindly go through. So it is in traditional medical schools, it focuses on the pathology, and then there is a strong foundation that is being laid, and general pathology and variants are, of course, a little too much traditional of yesteryear. Here, integrated is pathology is blended with the other clinical subjects, and you find that there is an integrated setting in which pathology should find a place. Students will know the importance. We used to call it as disintegrated teaching because though the concept is extremely good, in fact, this integrated teaching has become the rule of the day in some universities at Singapore, Malaysia, etc., wherein it is system-based. There is no department called as anatomy or pathology. It is cardiovascular system, and each of the faculty comes and teaches the student and goes. Anatomy of the heart, physiology of the heart, pathology of the heart, the diseases, pharmacology goes and treats them, teaches them the treatment, etc. It goes on like that. So it is system-based. But here, we are neither the conventional nor the integrated. So it is one of our favorite observations that it is disintegrated. We used to call it as disintegrated teaching. Another one is a problem-based learning. A problem-based learning is this. There is a problem, and then there are ideas, knowledge, learning issues, course of action. Again, this is a medical education topic a little difficult. I'll tell you exactly. So there is a facilitator or a teacher who gives a particular problem or a situation to a student. He thinks about it. The teacher is not supposed to divulge any information. He goes to various places, including the library, colleagues, and so on, comes back with ideas, and again is given some further clues regarding the laboratory findings, etc. And ultimately, there is a diagnosis that is being arrived at. So, this is the mode of problem based learning, which will consume extreme amount of time. Unfortunately, this concept is also not being properly understood and applied in medical teaching. So there are advantages. It is more student centered. There is a deep learning in this. We should not disseminate the teaching over here. It encourages problem solving approach and it promotes lifelong learning skills. And interaction also is being promoted. Wonderful things. The limitations are, see, how many topics can be covered by means of this problem based, how many students, so the students teacher ratio becomes very important. Also, you find that all students will not be having the same personality. They may be inhibited. Tutors also can be having mixed feelings. So all the psychological points also come into play. So ultimately, the problem-based learning also becomes a failure, efficiency-wise. So this is the traditional teaching over here. We are told what we need to do. We memorize it. And then finally, we deliver it at the exam. In this case, the problem is assigned. We are supposed to identify what actually the problem is and then learn how to solve the particular problem. This can be a simplistic difference between the traditional and the problem-based learning. Computer-assisted learning, all of you people know very much. We do not go and search for a journal. We download anything that we want. Recent advances to textbooks you people have got in your iPad. So there is an explosive availability of resources, multiple pathology websites. There are also packages, access to books, museum, unlimited images, and the students can repeat it any number of times. These can be advantages. But then be careful, less tutors are needed. Tomorrow you and I may not be needed for pathology teaching. And the computers are much better than us. They never get tired or bored. The problem is a lot of time and effort is needed, difficulty in maintaining the various sites, organizing is difficult, dedication is needed. As you people see, how much of time and energy I am putting in R.A.T.S. And the absence of a teacher per se can be detrimental. So just to show you the use of a computer-based teaching, minus an online and a YouTube teaching. This has of course reached the students. Thank you one and all. There can be other innovative methods of teaching. So this is a studio over here, wherein there is a radiology. It looks more like a photo studio to me. But then so much of language and then information is being gathered. Pictures are being organized so that the students can prepare themselves for various clinical pathological conferences and they can compete with their peers. Most students like this method. But then the problem is, if you are going to organize it and represent it at the exam, it becomes extremely difficult. And how are you going to measure and assess all this? And this again is multidisciplinary. I don't think medicine alone will be able to do this. It is incidentally at the John Hopkins Biomedical Engineering. Please note this. There are various changes in the education. The vacancies, he says it has increased, but to my knowledge, I feel it is the other way around. There is a fall in the number of pathologists, but we find that we are going in a different direction. And finally, the teacher says, after taking the class, kindly go on to the social media and rate today's lesson plan. This is what is being done. At the end of the class, the student will be knowing all these things and so on, so forth. Mechanically, it is being repeated without any iota of thought. And in the current curriculum, pathology is at a low level. Innovative teaching, a lot can be done by individuals. Here is a beautiful LCD projector. Obviously, I think it is being connected to the net and anything can be derived. It can be sent to various places, recorded and stored. So these will be consuming a lot of time, teaching and preparation. The involvement of the non-consultant staff is required. And also they say the postgraduates and retired pathologists also might be needed for teaching. This per se is again an element of mismanagement of manpower. Only thing, it has to be reorganized n number of times so that it is delivered to the students. We'll have to manage the time, manage the manpower, manage the space. For example, this. I have taken it from medicine as such, but then you see the teacher or a coach, he gives the directions. It is a scenario over here. It can be to the clinician and the medical students or the senior colleagues, they give the direction to the medical students or the junior faculty. And then they go to this particular scenario and then they take an understanding of it and go back. So this is a mode of organizing. So it can be for organizing various classes or it can be in getting the radiological and the clinical picture, etc. Also, you find that the postgraduates nowadays are being used for all this. Is pathology teaching extinct? Does this matter? Yes. Students fail to understand the disease and the mechanisms. Problem-based learning, I told you the limitations. They cannot correlate the laboratory services. They have only by-hearted the objective types. Thus, doctors of the future will not have a knowledge of the terminology of pathology. Necrosis, infarction, gangrene may be nothing to them. And pathology cannot be brought to the students. Students would prefer that choice. And assessment becomes difficult, and with most of the institutes having NEET and next in mind, I do not know where pathology is heading. What is the future of the pathologist? He says. This is again more or less a repetition. For pathology as a career, what do you need? Will it be the mode of teaching or is it going to be the modern knowledge? And the loss of pathology from the modern curriculum means you and I might become extinct. Therefore, the pathologists must act as role models. Pathology teaching load must be managed well. Difficult and novel methods are needed. This is another problem that is haunting us, the foundation course. In the first year, the students are exposed to all the subjects, starting from anatomy to surgery. They feel that they should have an idea of everything and develop it progressively honestly. We know how chaotic it is. It is a double-edged sword, but in reality, it becomes more of a formality. This has to be again analyzed critically. These are not my words, but the words of the author. Exactly the same thing he has narrated more than 5 to 8 years back. But today, we are confronting the same problem. What are the points for ponderance? So, pathology is actually the basis of disease. Probably it is Robbins he has in mind. It is misconstrued to be a fact-based basic science. Most of the curriculum are taking away the real pathologist towards computer-based pathology. Academic pathology is under the threat of extinction. Pathologists of the future must restore the profile of their subjects. So otherwise, you and I do not have any place to stay. That is what he says. Stimulate yourselves. So my dear students, this is the last slide. It is called as Bloom's taxonomy, which plays a vital role in medical education. There are various steps such as remembering, understanding, applying, analyzing, evaluating, and creating. I would advise you people, when you pass the exam, to have an inclination towards medical education department, which might be vital for your progress in your career. That having been said, I have lost track of what we are trying to accomplish. This is a sad truth. Now, I do not know where I stand, whether what I am teaching is correct or wrong, whether it is required for the student or not, whether it will stand the test of time or not. All this shall remain to be seen. Thank you.